there is nothing to worry about because from November 1st onwards, we have found a slight increase in the number of COVID cases. So we had a rapid response team state level meeting and a ministerial level meeting was held, and in my meeting we decided to start genomic sequencing back in November, and on November 18th we started to send samples, and the sample which was sent on November 18th and that sample was of a woman who was 79 years old, and she was and her sample was found positive, and it was found JN.1, and that single sample. See, she was in home isolation and she has come out of COVID and she's perfectly all right now. She's a 79-year-old lady and she's perfectly all right now. She's in her home. And we have been sending samples from November 1st onwards. So we are doing tests and you can see that the number of tests in the state is high when compared to other states. And naturally, then we find more positive cases. But the ICU occupancy, the ventilator occupancy and the isolation bed occupancy, when you analyze the situation, there is no increase in ICU occupancy, ventilator occupancy or isolation bed occupancy. And the deaths occurred, they had severe comorbidities. Like one person had, he was severely ill with the cancer. He was hospitalized, and some other patients had CKD, chronic kidney disease, heart disease, etc. So all were having chronic diseases, and no one had a COVID complication and or any situation like that. They were found negative when they were ventilated or then were in ICU because of their diseases. They were found positive. So, but now the situation is totally under control. So we had only one single JN.1 case, and we have to expect more cases because the airport surveillance done in Singapore airport shows that 19 passengers from India, not from Kerala, from different parts of India, 19 passengers were found JN.1. So the samples of them were found JN.1 as JN.1. So we have to expect more cases, and we have separated beds for isolation bed, ICU beds, then ventilators, etc. All are ready. We have plan A, plan B, plan C, etc. There is nothing to worry about. The transmissibility of this variant is high, but the severity is less. So there is nothing to worry about.
From breaking news, detailed analysis, in-depth interviews and explainers, follow the Times of India. Subscribe to our YouTube channel. Don't forget to like our videos and hit the bell icon to stay updated with the latest.